I'm going to be doing a lot of research. I'm going to be doing a lot of improving of my midwifery clinical skills and taking that opportunity. But for me, one of the things I'm really focused on doing is a very deep dive into the metaphysics of midwifery from an international Indigenous perspective. So, what are the different approaches? How do we fit birth and childbirth and menstruation and menopause? How do those things fit within our cosmologies? How do those cosmologies actually impact the medical practice? And studying examples from other people, from other nations, and also looking at those stories then within my own, and kind of utilizing the work that's been done outside of my nation to kind of apply it to the work that's being done inside of it right now. And so that's my big focus, is actually kind of on the spiritual, um, metaphysical aspects of these things, and kind of where that spirituality meets holy science, right? The ceremony is the merging of science and spirituality, and that holy marriage is kind of where I really want to focus. I am a home birth midwife. I've been doing that really since I was 18 years old. I've been attending home births and out of hospital births, and so that's been almost 15 years of my life now. And I've really been working and been very active in the revitalization of Indigenous birth practices, not just amongst my own people, but also really working on those movements on a national and international level. And so for me, this is always something that's always very near and dear to my heart. It's something that I care very deeply about, and that I think is very timely as we talk about different activist movements in Indigenous community, even talking about land reclamation and land restoration, how deeply those things are tied to how we birth and where we birth, and by kind of under whose authority. It's a really It was a huge loss of our respective tribal sovereignties when we lost control of how we bring our babies into this world. And so for me, it's always been much more than even just about even just perinatal health disparities. Those are obviously a really big issue. It's really a huge movement to reclaim our personal and collective sovereignty as Native peoples. There's a collective devaluing of the work of midwifery within the continental United States. This is not true globally. As medical systems kind of developed worldwide, midwives were often worked into the fabric of the healthcare system of their respective countries. Obviously, we look to Europe as kind of like the gold standard for perinatal outcomes in the world, and part of that is because they've very thoroughly integrated midwives into their systems. The United States has not done that. And so it's always kind of a gamble. It's a risk about how I'm going to be treated, how my clients are going to be treated, anytime we do have to cross over the threshold of a hospital. So when we talk about Western medicine, I think there's a really important delineation. Western medicine is a philosophy versus Western medical techniques or like specific pharmaceutical medications. So when we talk about Indigenous midwifery, what we are not talking about is Western medicine or Western medical philosophy integrated into or like practiced on Native people. Like that's not what we're talking about. What we're talking about is how do we utilize like Indigenous medical paradigm, so a Dakota medical paradigm, not a Western medical paradigm. And how then can we use the tools of Western medicine, things like blood tests, things like pharmaceuticals, things like even like a Doppler? How do you utilize that then within the context of Indigenous medical practice rather than Western medical practice? What can we do is we can take what's good and leave behind the things that haven't been serving our people, that don't serve our people, and will likely continue not to serve our people. I'm very much of the opinion that home birth is not for everybody. Not everybody needs to have a home birth, or that needs to be something that happens on the journey of the life that they're taking. I'm very much more interested in birthing autonomy, that we have the right to choose how we bring our babies into this world. We have the right to have care providers from our communities that look like us, that are able to offer culturally appropriate care, that we are empowered to make those choices and to understand that that people don't get to get to make decisions about ourselves, our bodies, or our babies without our consent. In your home, we actually kind of learned this during quarantine, is that secondary infections, during the COVID pandemic, we learned that like secondary illnesses, it's a lot harder to transmit secondary illnesses when no one's talking with each other, when you're in your own home space, when you are surrounded by the bacteria, by the viruses, by the germs that are normally living in your house, because you have immunity to those things. You are safe in that space. And which means that when your baby comes into this world, not only are they already usually immune to those things because of your own immune system, that they can be rapidly inoculated by everyone else who already has standing immunity to them. So, I mean, there's a whole host of different reasons about why home birth in many different ways is sometimes healthier for the normal pregnancy. And it goes far beyond even just, access to medical procedures. Sometimes it's literally just about infection exposure.